Aloha, welcome to Healthcare in Hawaii. I'm your host, Josh Green, Senator from the Big Island, works in the ER doc as well. Today we're going to speak about smoking policy. Our topic today is policy that kicks butts, because we're going to talk about Kick Butts Day. I'm joined by two excellent individuals. First, Jill Tamashiro, Secondhand Smoke Coordinator at the Department of Health Tobacco Prevention and Education Program. Jill's work focuses on reducing public's exposure to secondhand smoke, which kills everybody, by educating populations about its negative impact on health and encouraging compliance with existing laws. Jill has a master's degree in public health from the University of Hawaii at Manoa and specializes in social and behavioral health sciences. Prior to working at DOH, Jill was at a nonprofit health setting, including the National Kidney Foundation, who I'm very fond of and been on our show before, and the Waianae Coast Comprehensive Health Center, who we know does an extraordinary amount of good work. We're also joined by Trish La Chica, who is celebrating her first anniversary. Congratulations. She's the Policy and Advocacy Director of the Hawaii Public Health Institute. Jill worked closely with state policymakers like myself and community advocates to advance policy initiatives in tobacco control and obesity prevention. Before coming to the Hawaii Policy and Advocacy position, she was working in the governor's office, working on state health policy, which I was happy to help recruit her for, which was wonderful. It was totally the good luck of ours in the state of Hawaii. Also, she works on health system improvements, quality of care directives and initiatives, decreasing cost of healthcare for our residents, which is a constant issue on our show. She's worked on Native Hawaiian health, Asian American health, Pacific Islander health issues. We spoke and met over cancer questions, earned her master's degree in public administration from University of San Francisco and her BA in the Philippines, in Manila. So thanks for being here, guys.
Thank you.
It's great to have you. So today's topic, policy that kicks butts. We're talking about tobacco policy. Why don't we start right off the bat? You're doing something important on Thursday, right? Tell us a little bit about that.
So Thursday is going to be our Kick Butts Day. This is March 24th.
Right.
Kick Butts Day is really a national day of activism where different states across the nation work with the youth, and the youth come together to speak up and talk about why it's important to ensure that the next generation is smoke-free.
Yes.
So here in Hawaii, we're going to be celebrating that on Thursday. We're inviting our youth from across the state to come and join us. We have about 60 to 70 students, high school and college students joining us on that day. There will be a morning session, but we're asking for folks who do want to drop by and be able to speak up. It's, we tell the youth all the time that their voice matters, and this is an opportunity for them to not just speak up against tobacco and also smoking and talk about issues that matter to them, but it's an opportunity to meet with their legislators. So we're going to be at the Hawaii State Capitol on that day. Please come at 11:30 in the morning, and feel free to call our number.
What's the number? Where should they call you guys?
Call us, Tobacco Free Hawaii. It's 591-6508, extension 3. So we can sign you up and make sure that you're prepared when you get there. But it's 11:30 at the state capitol. There will be a table there where they can sign in and join us. There will be sign waving. There will be an opportunity afternoon to meet with legislators such as yourself. You'll be speaking during the rally, but it's also a way for them to meet with all the state legislators. And it's really a good way for our youth to become involved and get the skills to become, the next generation of leaders.
Right, we need that. We need them to lead by example. So I think it's extraordinary what you're doing. And why is this important, Jill? What's the, what's been your experience about bringing young people into the movement? Is it easy? Is it difficult?
My involvement with the youth has actually been more on the periphery, but I do know that with our, any of our policies, when youth get involved, the legislators or the community really listens to youth, and they really bring their passion to the cause.
Yes.
And just one youth speaking just sometimes has more impact than a room full of adults.
You're absolutely correct about that. When we have a hearing and if there's a group of young people speaking on a bill like this, if there were a series of bills like these, which we're going to dive into in our show today, I think it does kind of create an extra energy in the hearing rooms, and there, I think the legislators take it to heart because there's not an agenda for young people.
Exactly.
Yeah. So young people will come. Are they high school students? Are they middle school?
High school students. This year's policy priority, we work with a youth council, and they have identified as their policy priority for this year is smoke-free vehicles when a child is present.
Yes.
And so they will be talking and raising, awareness around that issue. And this would be applicable, this law, should it be passed, would be to protect minors, and so those under 18. And so we're encouraging, of course, students of all, of course, of all ages, but really those that will want to support this law. And then to come, we're having high school and also college students currently that have signed up, but it's open to anyone. Right?
Okay, so that's for this Thursday, which is the 24th, right, over at the state capitol. Talk to me a little bit about this bill, guys. Now, you described it to me, and of course I know about it at the legislature. This is meant to prevent people from smoking in their cars with children. What does the bill do? What's it say specifically, Jill? What's in there?
Well, it's actually a pretty short, very simple, straightforward bill, and it just prohibits smoking with any minor present, anyone under the age of 18.
Yes.
I believe it does impose a fine for that.
Right.
I think it's $100, if I'm not mistaken.
Yes.
And we've had a lot of discussions about that with our police and our enforcement bodies. And as you know, we were talking earlier about how it's currently in effect on the Big Island as an ordinance.
Yeah, tell us about that. When did that start?
I believe that was 2010.
Yes.
And so that was pretty groundbreaking. They were way far, the Big Island is way far ahead, from other places in the country.
Which is so interesting because, sometimes on Big Island, and that's where my district is and where I work in the hospital, so on some issues we have great disparities and we have a very difficult time getting people access to care. And in other areas, they end up being the trailblazers, the groundbreaking leaders on health policy. And I really give the county council, all of them, an incredible amount of credit because they were, early on they were banning smoking on beaches, right? And then, in cars. Now, why don't you tell us, you're a secondhand smoke expert, right? So why not in cars? How bad is it for kids if there's smoke around them?
Yeah, so this policy really is a kids policy. It's primarily to protect kids because, as adults, you can advocate for yourself, you can assert yourself. A child, even if they don't, if they don't want to be exposed to secondhand smoke, doesn't have that ability to speak up oftentimes.
Right.
And so the data shows too that exposure in cars, it's a lot more concentrated just because of the physics of smoking in that confined space.
Right.
So, the numbers that show the toxicity is like 25 times that of like in bars, or it's just really, really, really toxic. And I think there's just not enough awareness about that. I think it's, we're working on that, obviously, but it really is a kids policy.
Yeah. It's great. I think that you guys have taken up a lot of empowerment policies because in this particular case, it would empower young people to be healthier, which is why it's so great that, Trish and you guys are getting them out to testify and to kind of rally. But wouldn't it be fair to say that a lot of these policies have been empowerment policies because, for instance, a couple years ago when you guys led the charge and we passed legislation to have smoke-free workplaces, especially bars, a lot of individuals who work at bars, who are servers or doing dishes in the back or whatever, isn't it true that a lot of them are kind of disempowered to a degree? They can't stand up to the owner or the boss?
Yep. Yeah, so smoke-free policies, I think one of the biggest effects or biggest impacts or significance of smoke-free policies is that they shape social norms, right? And the norm is what empowers people. I like that word. And because a lot of people don't like it, but if it's the norm, then you kind of just roll with it. But once it becomes law, then people feel, they can speak up for that. So that's actually like, I'd say one of the biggest purposes for having a smoke-free policy.
Yeah, it's very helpful. And has it been effective? What's going on? You have a broader perspective, right, Trish? At Hawaii Public Health Institute, we seem to talk a lot about tobacco policy a lot. Is it working here in Hawaii?
In terms of smoke-free cars in the Big Island. We know that we've been in conversation with the Traffic Services Division there, and we know that it's currently something that's working. They are seeing it as it's not a burden for them to enforce for the Traffic Services Division, but it's similar. The enforcement, of course, on smoke-free cars would be similar to our current smoke-free air laws, where it's really on the focus is really on educating the public and changing social norms, and really not meant to be able to burden the police on enforcing it, but it's really to be able to change behaviors and have the community adopt like healthier behaviors.
Right.
We're seeing smoke-free cars happening across across several states as well. About 7 states have already passed this into law. There would be Virginia would be the 8th state. It's currently sitting in the governor's desk for signing right now. It's a law across the United Kingdom, and there's one study, because it's been a law since over 5 years, where they really did a survey to assess the level of exposure of secondhand smoke among children, and over those 5 years it's been cut by half. And so it's proof that policies like that exist. And smoking in cars, you can really see how it produces harm, because there's harm on first the individual who smokes and inhales the smoke directly. There's harm that is caused directly to occupants of the vehicle who are inhaling the toxic secondhand smoke, including smoke from vaping and e-cigarettes, and also the potential harm that's produced not just from drivers who are distracted from smoking and being not having their attention on the road, but also because children in cars are seeing smoking as like the adult, as normal adult behavior, and it's setting an example for the kids who want to be healthy and live healthier lives.
Right. Well, let's hope that the kids come out and speak up, because I tell you, one of the things I like about having health experts like yourselves here is I learn a lot. Like I wasn't aware that the intensity was that great on individuals. It makes sense in a closed area, a contained area. Some people are driving for an hour or longer. We know people are stuck in cars. God help them on Oahu.
Just smoking half a cigarette or a cigarette for a few seconds would produce air levels that exceed what the United States Environmental Protection Agency considers as hazardous. And all these studies have been done around it, just looking at the air quality levels, and it just produces so much unhealthy air that makes it difficult to breathe. And immediate effects would be irritation in the eyes, on the throat, and of course with kids, it impacts the way it impacts their performance in school and ability to engage in other things such as physical activity.
Yeah, it's so tough. And we do have high incidence of asthma, if I recall, here in the state. So we're going to be contributing to, I guess, worsening their chronic lung disease. God forbid someone's got a kid with cystic fibrosis or what have you, but so many challenges that taking up this kind of cause is very helpful. Now, it's in committee right now, right?
Yes.
So you guys are deploying your forces, and you said there's 7 other states, Virginia plus some other countries, the UK. What's the prospect this year? Do you have expectations yet?
We're very hopeful. As as everyone knows, it takes a lot of effort to be able to pass a bill into law. It goes through several different committees, public hearings. There's a lot of opportunity, especially for the youth, to come and be able to speak up, because that makes a big difference when the legislators can see how much this issue matters to them and impacts them directly. So right now, Senate Bill 2083 has passed through the Senate and is now in the House. It's actually being heard today, this moment, right now. And if this measure passes committee, then it'll go to its final committee before we see it either go through conference or being passed as law.
That's great. Well, look, right before we take our first break, I just want to thank you for all that work, because that alone justifies this program. So for those of you who are out there, be aware there's important legislation. It's not my bill, so I feel happy to shill it, although I'm a huge supporter of this policy. Let's try to make sure that secondhand smoke is not affecting our youth in vehicles. It's 25 times more potent than we can tolerate than regular smoking. Secondhand smoke does definitely cause lung disease. So I'm Josh Green, your host for Healthcare in Hawaii, doctor from the Big Island and senator, and I'm joined today by Jill Tamashiro, and Trish La Chica, experts in health policy. Thanks for joining us.
Hi, I'm Donna Blanchard. I'm the host of Center Stage here on Think Tech Hawaii. I hope that you will tune in and watch the show. It is inspiring and uplifting and educational also. We talk with artists of all different ilk. We talk with them about what they do, how they do it, and most importantly, most dear to my heart, why they do it. And it never ceases to be fascinating when you get the answer to that question. I hope you'll join us on Center Stage, 2 o'clock Wednesday afternoons. Aloha.
Aloha, my name is Justine Espiritu, and I am the co-host of Hawaii Farmers Series. This is my co-host, Matthew Johnson, and we are live with you every Thursday at 4 p.m. at thinktechhawaii.com. And our show focuses on Hawaii's local food community. We feature not only the farmers that are producing our food, but we also feature the supporters and other folks involved in the community that are trying to promote local agriculture.
Aloha, welcome back to Healthcare in Hawaii. I'm your host, Josh Green from the Big Island, work in the Senate. Today we're talking about policy that kicks butts. Specifically, this is anti-smoking legislation, I would say advocacy for people, young people. In our first segment, we talked specifically about how to advocate for children. And there's a piece of legislation moving through the legislature right now that would make it illegal with fines to smoke in a car with kids under age 18. I'm joined by Jill Tamashiro, who's the Secondhand Smoke Coordinator at the Department of Health. Trish La Chica, one of my favorite people at the Policy and Advocacy, who's the Policy and Advocacy Director at Hawaii Public Health Institute. These are people, you guys are in the front lines. You're advocating for many people. You're bringing them together. You told us earlier we have Kick Butts Day, which is Thursday. People should come to the Capitol. So you're moving the needle. You're making sure people are healthier. Now tell me about secondhand smoke, Jill. I'll hold this thing up. You gave this to me. This is from DOH.
Okay, well, so I guess the general background about secondhand smoke is that there's basically no safe level of exposure. You know, like a lot of people will ask, well, how much is okay? You know, just a little bit is fine, but it's very clear there's, you know, and even small amounts can be really harmful to certain people. And as Trish was mentioning in the earlier segment, like, you know, just within like half a cigarette or within 5 minutes, like toxicity levels of secondhand smoke can exceed, you know, what's standard or recommended
at the
by
EPA,
the
right?
EPA.
Yeah.
So it's really bad, and just the amount of chemicals in secondhand smoke are exorbitant. It's about 7,000, and you know, 70 of which are cancerous or carcinogenic rather. And you know, right now in Hawaii, we have we're pretty progressive in terms of smoke-free policies,
yes,
like as compared to the rest of the country. So our smoke-free clean indoor air law, which started in 2006,
yes,
that covers all the bars and restaurants, all the public places indoors. Believe it or not, that's, you know, there's 50% of the rest of the country does not have a basic clean indoor air law.
Amazing.
So,
yeah.
Isn't it amazing? Like, I thought that by now, you know, at least that those basic areas would be covered. But
Yes.
so, you know, in Hawaii, we've had that in effect for about 10 years. And then we went so far as to, thanks to the legislature and the counties, we have pretty progressive laws. So now, you know, our smoke-free environments have expanded outdoors to parks and beaches,
Yes.
which has not only health effects but environmental protections as well, because of the cigarette butt litter is like the #1 most littered item in the world. So we have awesome beaches that we want to protect. So
Yes.
so it covers our, you know, outdoor areas as well. But given that we have a lot of public places that are covered, so now the majority of exposure is occurring in homes and cars.
Right.
So, and the people there that are exposed most and are the most vulnerable, like our kids, our elders, people who are less autonomous.
Yes.
You know, so those are pretty big secondhand smoke issues
So
right now.
yeah, so you've prioritized this year knocking out smoking in cars with children around, and there's also some housing questions, right? So you guys have worked on housing legislation where they're should be smoke-free housing. Could you tell me a little bit about that?
Well, right now, only public housing is covered under the smoke-free air laws, but we still, as an organization, we still get a lot of complaints, and as well as from with Jill's department, a lot of calls just from residents. Like even in my own apartment complex, like I have neighbors who smoke all the time, and even if they're not allowed to smoke in common areas, they still do that, and it still affects people who, especially those that share have shared structures, like share a common wall or live in multi-unit dwellings like condominiums.
Right.
The only problem is like these are policies that have to be passed at a board level or
Right.
through their current not just the what is the
The CCNR maybe or
the
something.
associations
Yes.
Yeah.
and the boards.
it has to be enacted through a majority vote through all the residents to be able to adopt it.
Right. Are we seeing that happen? I mean, I know that we passed that legislation. Is there pushback? At some of the condominiums, people buy fancy or expensive condos. Do most of these buildings make that vote and vote to have smoke-free buildings, or is there pushback?
There is a lot of pushback, actually. So that is a really big issue for smoke-free housing because, in Hawaii, we have a huge stock of condos,
Right.
right? There's a lot of individual owners, and so they're operated individually. And so that the challenge is, like Trish was saying, that each individual condo has to adopt their own policy. And
Right.
to get 67% of people to respond, let alone vote yes, is
Very
pretty
challenging.
Yeah,
tough.
that's the
Yeah.
policy issue that's the issue we're facing now in passing that policy, because if you look at it, if you're a condo association that has 500 residents and you're required to have 67% vote to pass it as a policy, that includes every single ballot, every single vote that comes back in, and if it doesn't, you don't mail it back in, that's counted as a no vote. And majority of our residents here don't even live on the islands or are investors, and
Right.
so it's a big barrier for us to be able to pass this into law. But we did have a legislation that we unfortunately had died early in the legislature, but it had aimed to protect prospective buyers and renters, where the seller or the landlord would disclose whether similar to lead, asbestos, disclose whether the unit had been previously smoked in, and also whether there was an existing smoking policy. So not to say that the building would be smoke free, but if there was a existing smoking policy, it would help be able to promote and let at least the residents know and potential buyers know what they were going to be moving into or investing into before they purchase or make an investment.
That's very good, because I can tell you, I have a personal story actually. One time back when I was much younger in medical school, I got a terrible call from an old friend who said that her mother had passed away, and she had very, very severe asthma. Moved into an apartment on the mainland back in Pittsburgh, and wasn't aware that there had been just very, very heavy smoking. She had an allergic reaction to the smoke, and she was found dead, believe it or not. And that's a true story. So, it's not always that grave, of course, but when people come and they're going to invest in paradise, I think it seems fair that we at least are advocates in many ways for them, and one of them's got to be a health perspective. But that kind of thing does happen, and I can only imagine the frustration that people might have if they're very sensitive to smoke or have children. I mean, I've got 2 little kids, right? And if I've woke up one day and found that there was a lot of secondhand smoke coming into the hallway or into some common space that we shared, I would worry about them. So it sounds like we probably need to look at that. But you're taking a proactive. You've already won, right, on beaches. You've succeeded in the workplace. The cars seem to be next. What's the next major area of legislation that you guys think will kind of rise to the top?
For smoke-free policies, we're hoping to eventually, delve into the housing. That definitely is the next frontier.
Interesting.
just for the reasons we were talking about, like
Right.
a lot of the exposure now, like the data shows that, we have that CDC data that shows that 1 in 3 renters are exposed to secondhand smoke across the country. And
Mhm.
so it is an currently unprotected environment that needs a lot of protections.
Yeah, well, let's talk
So-
about some of these statistics here. Here you say 58 million people in our country, that's 1 in 4 non-smokers, 58 million people in the U.S. are still exposed to secondhand smoke. 2 out of 5 children, including 7 out of 10 black children, are exposed to secondhand smoke. So there's a economic and social disparity, which in this case is race-based, which is very disconcerting. Then more than 1 in 3 non-smokers who live in rental housing are exposed to secondhand smoke. So it looks like there's kind of ample areas for improvement. Yeah, are these national initiatives that you take up? I see that this is from the CDC.
Yep.
So the CDC makes these recommendations, they pass them on to experts like you. Is that how it usually goes?
Yeah, well, so it is a national movement. Smoke-free housing is very much endorsed by the CDC, by HUD now. They're actually considering, even though our public housing is smoke-free by our own state laws,
Yes.
which we're the only state in the nation to have such a law.
Wow.
But the HUD, the U.S. Department of Housing and Urban Development is considering mandating it across all public housing right now.
Interesting.
So you were one step ahead.
So it's possible that the work that you guys did last session, or 2 sessions ago maybe, sets a national policy. And that's what I constantly try to tell people that watch our show or that watch the Hawaii legislature. Keep an eye on what Hawaii does, because in some areas we're the most progressive in the country. Wasn't it just last year that you guys fought for smoking age 21, Senator Baker's bill, right?
Yeah, so last year, as of January 1st of this year, Hawaii became the first state in the nation to raise the age of sale of tobacco products, including electronic cigarettes, to individuals and purchasers under 21 years of age. So because of that, there was really a lot of media attention. The whole nation, and even the world was focusing on Hawaii. And we've seen now so many states, so many jurisdictions and cities have followed suit. Chicago, San Francisco, New Jersey would have been the second state, but unfortunately, Governor had vetoed that bill.
Christy, jeez.
So we're still the first and only state as of this now. But as of now, but I think there are so many dozens and dozens of other jurisdictions that have passed.
And if I'm not mistaken, that was important because not only does it delay to some degree the length of time that people shouldn't smoke or ever smoke, but there's been a belief that young people can get cigarettes from their peers. And if they had peers that were 17, 18, 19, they were getting tobacco and sharing it. But if it was 21, there was a pretty big gap there. And so a lot of high schoolers and adolescents were less likely to start smoking, therefore less likely to be addicted, and therefore less likely to be adult chronic smokers.
And we see, this is an Institute of Medicine report where it's like 95% of smokers were introduced to cigarettes before the age of 21.
Wow.
And that's pretty consistent with Hawaii local data, where 9 out of 10 are also have been introduced to smoking before the age of 21. And this is where this policy, comes from.
Do we expect to see a precipitous decline in smoking because of this law once it kind of solidifies, once we've had a couple years? What's the expectation? Do you guys know?
I think that is definitely the hope, because it's not precedented necessarily. We don't have a whole lot of data to support that yet.
Right.
I think there's a jurisdiction in Massachusetts that had the policy for a couple years, and they do show that their youth rates had dramatically declined. So,
and it's part of our evaluation. We want to be able to evaluate the effectiveness of this policy, and so that's part of what our next steps is to really look at tobacco sales and see if it's declining and if there is an impact. And also, part of the implementation of this law is really focused around education, and so we're really trying to get vendors and also tobacco vendors also up to date on the current laws, and also provide them with the necessary signage in different languages too, because we have a lot of tourists that come into and visit the state.
That's great. I think we're going to take our second break here, but this has been very, very helpful for me to see the scope of the legislation and policy that you guys have been taking up. I'm Josh Green, Healthcare in Hawaii's host, and I'm joined today by Trish La Chica, who's over at the Hawaii Public Health Institute, Jill Tamashiro, who is a leader at Department of Health as a Secondhand Smoke Coordinator. And we're talking about smoking policy and policy that kicks butts. Thanks for joining us.
Aloha, I'm Rachel Yergin with Aging with Grace. Please join us every Tuesday on thinktech.com.
Hello, I'm Stephen Katz, and I'm the host of Shrink Wrap, which comes to you live every Tuesday at 3 p.m. on thinktechhawaii.com, and then it's repeated again whenever you want if you go to the website. On our show, we will be talking to all different kinds of therapists, psychologists, psychoanalysts, psychiatrists, people who talk about the mind, the brain, and about different ways to find happiness. I myself am a marriage and family therapist in practice here in Hawaii, and I hope you will join us because I've got a lot to learn, you've got a lot to learn, and it's a great ride. Thanks a lot. See you soon.
Aloha, welcome back to Healthcare in Hawaii. I'm your host, Josh Green, Senator from the Big Island, working the ER. Today I'm talking about policy that kicks butts. And we're trying to be a little clever here, but what we're really talking about is smoking policy in the state of Hawaii, where we've been leaders. Just last year, we passed legislation to mandate that no one could smoke under age 21, couldn't buy cigarettes or e-cigarettes. We're going to talk about that. We're now working on legislation that will prevent people from smoking in cars, hopefully, where it's 25 times as concentrated for our youth. It's really, really terrible for young people to be inhaling secondhand smoke. We know that it's disproportionately affecting minorities. 7 out of 10 black children are exposed to secondhand smoke, 2 out of 5 children otherwise, whether it's in cars or in public housing or wherever people are smoking, it is very bad for them. So I've got 2 leaders here today, Jill Tamashiro from DOH, Trish La Chica, who's from Hawaii Public Health Institute, and we've talked really kind of in a nice way, a broad way about what you do and the event that you got coming up again on Thursday, which is Kick Butts Day at the Capitol in the morning. So young people come out, parents come out. But now let's talk about electronic smoking devices, e-cigs. This is scary stuff, it says on this handout, and I would tend to agree. The proponents of e-cigs have been marketing them to kids. They've been saying that they help people get off of traditional cigarettes, but that hasn't been borne out to be true, has it?
Yeah, the research doesn't support that. We don't have, we can't say that it's a proven cessation device, even though anecdotally, there'll be a lot of people that swear that it helps them. And of course, no one would want to discourage any individual who's trying to quit smoking.
Right.
So, but just on a public health scale, we can't promote that as a cessation or a viable cessation device, especially because the data is also showing that it's more of a gateway device, for youth that would never even smoke a regular cigarette might try an e-cigarette and be exposed to nicotine at an age where they is really, detrimental for their growth.
It's a stimulant, it's highly toxic, and I think it was either University of Hawaii or the Cancer Center that came out with a study that showed that there was a direct linkage, like you said, in a gateway, in a kind of a gateway drug approach, that people who were smoking e-cigs early on were getting all that extra nicotine, and then when they didn't have money for the smoking devices or when the temptation came to try traditional cigarettes, they did become smokers. Is that what we're worried about?
Yeah, that is definitely, something that's a fear. And, just we've all known that, our experience with tobacco, that we want to be precautionary about it. We don't want to wait till it becomes a reality. So if we've seen that happen with tobacco, we want to be extra cautious about that with e-cigarettes.
So all this legislation that we've been talking about not smoking in cars, not smoking in public housing, not smoking before age 21, does that all apply to e-cigs?
Yes, to the age 21. Right now, it's still because the law, because the definition in our Clean Indoor Air Law now includes e-cigarettes.
Yes.
So it depends on how the housing agency is going to interpret that to apply to their law. So I can't really speak to that right now, but it originally was not included in their law. But So it depends on just how they plan on interpreting that.
That seems like we probably ought to head that direction. What do you think? So Trish, you're rapidly becoming an expert on legislation. Other states are probably getting interested in this too. What are you hearing at Hawaii Public Health Institute?
Because electronic cigarettes are defined in our current statute as a tobacco product. As you know, electronic smoking devices are being used to really produce an aerosol that can be inhaled by the user. And they're using, if you look at e-liquid, which is what helps to produce that aerosol, it still contains nicotine, which is derived from tobacco products. And nicotine is an addictive substance.
Yeah.
The e-cigarette folks don't deny this, and of course, because electronic smoking devices, it's not currently regulated under federal law, under state law, and with the surge and just the rampant use, particularly among the youth, and we're seeing just growing concerns of new e-cigarette smokers being introduced to nicotine and being addicted to electronic smoking devices. There's so many states, 27 states have began to look at taxing electronic smoking devices similar to tobacco products. Like the city of Chicago had already passed that beginning of January 2016, and we're looking to do that in the legislature this session to tax it similar, at least the disposable electronic smoking devices, because it already contains the e-juice and also the actual liquid, to be able to tax, looking to tax that. But also, because we know that the e-liquid, because of the nicotine, and nicotine is poisonous, there have been so many and hundreds and even thousands of cases of nicotine poisoning cases across the nation. The Poison Center has been getting a lot of this call, so we're also looking to regulate the packaging of electronic smoking devices. Not all e-liquids are child-resistant, have child-resistant packaging, and so a child can easily open it because they smell and look like candy.
Right, they're drawn to this. Like I see here, yummy flavors they advertise in some cases, where they come in bubblegum flavor, cotton candy flavor, yet the tobacco industry says they're not marketing directly to young people. Last time I checked, we're usually selling bubblegum and cotton candy to young people. So I worry about that as an ER physician, because just drinking one container of this stuff
Even just a teaspoon
can be quite toxic.
Fatal,
That's right. And I think you cited the statistic. I'll say it even more specifically. In 2014, 3,783 cases of nicotine poisoning related to electronic smoking devices were reported nationally, and I can assure you that we're seeing that here in our state. I can assure you firsthand. So what's the answer? Tax it, label it, lock it down. What's the best approach?
Because we know in our at least experience with taxing tobacco products, we know that every time we introduce a tax, it's another reason for users to quit. Especially for price-sensitive youth, because e-cigarettes are now being seen as an alternative to smoking, and smoking cigarettes, and it's being marketed as cool and fun and exactly receiving the same experience as you would in smoking a pack of cigarettes. With that, it's really part of at least our role to be able to begin to look at how we can best regulate that and prohibit the use among kids and prevent them from being initiated and becoming tobacco smoker.
Yeah, and I have to say, I've been so disgusted by the celebrities that have taken the payday and marketed electronic smoking devices, e-cigs in general, vaping, whatever those companies are. When I see that, I just think, I hope people don't go to their movies, because it really, it harkens back to a time many decades ago when smoking was all over the media and all over the movies, and Hollywood stepped up.
Right.
And they really, decided, they made a concerted decision to, not send that message that it was okay or cool. And I think we've seen a little bit of pushback, but it takes policy leaders like yourselves to, again, push back the other way. So, okay, so you're saying begin to clamp down. If I'm not mistaken, also, the price-sensitive question really works for us. It was my recollection that for every $1 that we increase the price of tobacco, it decreased adult smokers by something like 7 or 8%, but as much as 15% for youth smokers. So very price sensitive, very effective. Do we have a chance, do you think, to achieve that in the state of Hawaii? Are they doing it elsewhere?
Well, this is the first time that we're really beginning to introduce this in the state legislature on taxing e-cigarettes. At least we have started the conversation. There are so many legislators that are passionate about this issue too. Because we work across the islands, we're seeing and hearing reports of e-cigarettes being not just used in schools, even if they're contraband, but also being sold by kids to other kids. We're even seeing, because of the passing of the age of 21 law, that we're even seeing parents purchase e-cigarettes for their kids because they're unaware of the potential harms that can happen, especially for e-cigarettes containing nicotine to their kids.
Yeah, I think our message needs to be to those parents out there who are watching, don't let your kids be exposed to any nicotine, because not only is it toxic for their neurodevelopment, and people's brains continue to develop well into their 20s, we know that already, but it will stunt their physical growth. It also is very likely to put them into a place where they're much higher risk for becoming addicted to nicotine for the long haul, and they will become smokers. I mean, it's just fact. So parents out there, please be very mindful that the laws are there for a reason, and that smoking is really not something we want to expose our children to. I understand when people say it's a freedom for adults. Okay, if you want to hurt yourself, I suppose there's nothing I can do to stop it, or you. But don't let your children be exposed to secondhand smoke in cars. Don't buy them e-cigs. Don't encourage that at home. Try to set a good example. We only have a few minutes left in our show. You know, you guys get to see the broader scope of health policy. Just, kind of thinking out loud, what kind of things would you like to see in Hawaii in the next few years? Why don't we start with you, Jill?
Well, for me, I always talk about smoke-free housing. You know, like we mentioned earlier that it's a really big issue in our condos because people that are exposed in those environments are not protected by any laws, and they have very little recourse other than to wait out the year and the 67% vote.
Yes.
So, and we receive a lot of the complaint calls from them. So there's about 20 jurisdictions in California that have smoke-free multi-unit housing ordinances.
Wow.
That doesn't matter if you're public housing or privately owned. If you're in multi-unit housing, it's not legal to smoke. And it sounds a little extreme, but at one point, I think smoking in airplanes sounded extreme to some people.
Yeah.
So it's just the aerodynamics in a building. Like essentially, if you're smoking in one unit, it circulates through others. There's no way to contain it. So
yeah, no, I think that's very smart. And look, I'll remind people we spend $3 trillion a year on healthcare, much of which is associated with heart and lung disease as a result of tobacco. So that's a noble move for our country. We can actually be spending money on education and drug treatment and more care for people that otherwise can't afford healthcare. So that's a good start. And you, Trish, vision for healthcare.
Well, I'm really proud of the fact that Hawaii is considered a leader in our tobacco and smoke-free air laws. I would like to see that happen also with e-cigarettes. We have an opportunity to continue with all our innovative, legislation, and being able to, especially when we're seeing this just affecting our youth, and our children. We want to be able to see this change, and really, you're seeing, pictures of how our youth have organized and be able to really speak up and talk about why this policies, important policies that matter to them, and there's an opportunity to continue building upon those youth leaders' leadership, but also engaging with the legislature. We do have our the legislative champions such as yourself, but there are also, a few out there that are not as supportive of these policies that we need to continue building a relationship with them and educating them that these are important, not just to our youth, but to all of us, and to continue protecting our residents and our visitors from the different countries and mainland.
I really like that. And I'll tell you what, as we wrap up our program today, Hawaii has a great opportunity. It's already leading in this area, and I think a lot of people recognize that Hawaii can be the most extraordinary place to visit, the cleanest environment, the healthiest state. We've been the healthiest state, and many kudos to our Department of Health and their leadership over the years, and the physicians out there and the nurses and doctors. But we can lead on so many levels for health, clean environment, pristine environment, and you guys are leading the way. So thank you for joining us.
Thank
Thank you for sponsoring Kick Butts Day. That's this Thursday over at the state capitol in the morning, where young people will be coming together and speaking up for their health, their parents' health, their grandparents' health, and the health of our state.
Everyone, please come.
That's great. So thank you again. I had today Trish, La Chica, and Jill Tamashiro, who are really preaching to the choir maybe here, but a lot of people out there are still smoking. So please help your children and set a good example. I'm Josh Green, host of Healthcare in Hawaii. See you soon.